Of stroke survivors, 48% are partially paralyzed, 22% cannot walk, and 35 to 50% report complete or partial dependence with ADLs. 17% are unable to speak, and 32% are clinically depressed. The risk of subsequent stroke is the highest in the period immediately following a stroke. In the first year after a stroke, 14% have a second stroke, 30% in the next 30 days. Angina of the brain. A TIA is known as a mini stroke. 25 to 30% of strokes are preceded by TIAs. Signs and symptoms usually last a few minutes, but no more than 24 hours. Ischemic stroke or cerebral infarction is much like a myocardial infarction. Both cause cell death when oxygen and glucose supplied by the bloodstream are interrupted. Neurons in the brain will die if circulation to that area of the brain is not restored. Sometimes a patient's own tPA dissolves the clot and restores the circulation. The area of the brain not receiving blood flow determines the patient's symptoms. Thrombotic stroke clot remains attached to the blood vessel wall. Embolic stroke clot travels to the brain, commonly seen in AFib. Lacunar stroke occurs in small blood vessels deep in the brain, usually associated with long-term hypertension. Occlusive stroke syndromes, anterior cerebral artery occlusion, lower extremity deficit, loss of frontal lobe control, leads to incontinence, flat affect, slowness, cognitive impairment, and posterior cerebral artery occlusion leads to visual loss, ataxia, and vertigo. Signs and symptoms of strokes in the vertebrobasal circulation is vertigo, ataxia, double vision, nausea and vomiting, and dysarthria and ringing in the ears. In arterial disease that evolves over a lifetime, the first changes of atherosclerosis, fatty streaks, can be found in youth and young adults. Leading cause of brain ischemia, elevated cholesterol, hypertension, and smoking increases your risk of advancing atherosclerosis. It is estimated that up to 100,000 strokes a year could be avoided in the U.S. if hypercholesterolemia were treated better. Origin of the internal carotid artery at the bifurcation is the most common site. In AFib, electrical activity in the atria is disorganized, causing the atria to quiver. In AFib, you need to know that the duration of AFib if it has been less than 48 hours or more, the longer a patient remains in AFib, the greater the chances of a clot in the heart. Once clots form, conversions of the rhythm could cause the clots to break off and produce a stroke. Immediate general assessment of a stroke. Within the first 10 minutes, you need to remember your ABCs, vital signs, oxygen, blood sugar, labs, start an IV, do a 12-lead EKG, and a quick neuroscan. If any one of these three signs is abnormal, there's a 72% probability of a stroke. Facial droop, meaning uneven smile. Arm drift, hold arms out for 10 seconds, and if one arm drifts down. Speech, slurred, inappropriate words, or mute. Time equals matter. Within 25 minutes of arrival, Within 25 minutes of arrival, CT head without contrast, STAT, to rule out a bleed. Read CT scan, review patient's history, activate stroke team, and perform more complete neurological exams. tPA is the only drug currently available that can dissolve in the clot of an ischemic stroke, thereby restoring blood flow. Time-dependent treatment. tPA must be administered within 3 hours of symptom onset. tPA is only given in the emergency department, ICU, or treated patients 30% more likely to have minimal or no disability at 3 months. 11% increase in favorable outcome. Onset greater than 3 hours. You need to, messed up. Preventing complications. Monitor for neurological deterioration, DVT prophylaxis, aspiration pneumonia, UTI, and decubitus ulcers. Signs of hemorrhagic conversion of ischemic stroke. Changes in LOC, confusion, restlessness, tiredness, headache, pupil changes, motor sensory communication or dysfunction, nausea, and vomiting. If change in LOC, you need to monitor O2 sats, blood sugar, and blood pressure. Measures to prevent recurrent strokes. If no carotid disease or cardiac source of embolus is found, we are left with risk factor modification and antiplatelet drug therapy. Antithrombotic therapy, antihypertensives, lipid-lowering therapy, and treatment of AFib. Aspirin in acute stroke patients. Combined data from IST and CAST. 40,000 patients use 325 milligrams of aspirin given ASAP from time of presentation. First-line therapy for secondary prevention of stroke. Aspirin works. Plavix works only slightly better than aspirin, and Agranox has an additive effect to that of aspirin. The good news is you can protect against stroke. Stroke factors that cannot be treated are age, male sex, African American, Hispanic ethnic, and family history. Stroke factors that can be treated are high blood pressure, drug use, smoking, high cholesterol, inactivity, and CHF. Smoking cessation. It helps to recommend it. 5 years after you quit smoking, your stroke risk returns to that of a non-smoker. Cigarette smoking can cause plaque formation, blood pressure, platelet aggregation, increased blood viscosity, and increased coagulability. Stroke prevention and hypertension. Hypertension plays a role in 70% of strokes. It's important to treat systolic and diastolic pressure to 140 over 80. You need to manage your cholesterol. All stroke and TIA patients should have a lipid profile on admission. Limit alcohol intake. If you don't drink, don't start. Remember, alcohol is a drug. It can interact with other drugs. No science shows that alcohol promotes brain recovery. Exercise to reduce your risk of stroke. Include exercise in your daily routine, a brisk walk, swim, or other exercise, 30 minutes a day. And always check with your primary physician regarding exercise restrictions. Don't be a couch potato. Learn how to recognize stroke symptoms. Sudden weakness or numbness of the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Or sudden trouble walking, dizziness, loss of balance, or coordination. Call 911. Striking evidence. Prevention is treatment, stroke is an emergency, and time is brain. Done.